Hello everyone, the Nerd Medic here, and in this video we will learn about the concept of volume of distribution. So why we need to understand the concept of volume of distribution? So there are different drugs, and due to their unique properties, certain drugs have the tendency to localize in particular tissue and very small amount of them remain in the blood. Just like our drug A over here. The maximum of it is going into the tissue space and very small amount is remaining in the plasma. Whereas there are other drugs like the drug B where majority of the drug remains in the blood flow and a very small amount goes into the tissue space. Right. So now, as doctors or physicians, how we can understand which drug will go and stay in the tissue space majorly and which drug will stay in the blood space or vascular space majorly. So for that, we need to understand about a quantity, and that quantity is volume of distribution. Suppose we added X units of a particular drug into the blood plasma so that we can achieve a peak plasma concentration of C. Right. Now, in a lab setting, we have a container full of water and we add the same X units of the drug in that container, and we want to achieve a drug concentration in that container same as the peak plasma concentration of the drug, that is C. Now our question is how much solvent we should add so that we get the plasma concentration of that drug in the lab, right? That means in how much water or how much solvent we should add X units of the drug so that we get a drug concentration of C, which is the peak plasma concentration of the drug. That means the equation that we are getting over here is X divided by V is equal to C, right? The amount of solute, that is the drug, divided by the solvent is equal to the concentration. Okay. So now if we want to express this in terms of V, then V will be X divided by C. Right. Now this V is termed as the volume of distribution. Now let us understand this with an example and how this can help us. So for now, just remember this this expression over here. And now we will try to understand how this expression will help us in understanding the localization or distribution of drugs. Right. For an example, let us take the two drugs that we discussed. So drug A and drug B. So drug A has 10 units. Suppose we add 10 units, administer in the human, and we also administer 10 units of drug B in the human. Out of that, we see that 2 units of drug A remains in the plasma, whereas 8 units go into the tissue space. Whereas for B, we see maybe 7 units are remaining in the plasma and 3 units are getting localized in the tissue space. So this is the distribution, right? Now, if we have to calculate the volume of distribution for drug A and the volume of distribution of drug B, then we have the plasma volume is 100 ml maybe. For example, we have plasma 100 ml. So we need the peak plasma concentration of drug A is 2 units. So the plasma concentration over here will be 2 units divided by 100 ml. That is 2 by 100 will be the C for A. And the plasma concentration of B will be 7 units are remaining in the plasma, and the plasma volume is 100 ml. So CB will be 7 by 100. Right. So now we have the plasma concentration or peak plasma concentration of drug A and B. Now we want to understand the volume of distribution. That means if we add the same amount of drug in some other lab solvent, then how much solvent is required? That means what is the same amount? Same amount is the 10 units. Now we will add the same 10 units of both drug A and B in separate containers, and we will try to achieve 2 by 100 concentration for drug A and 7 by 100 concentration for drug B, and we will see how much of a particular solvent is required. And generally the solvent used is water. That means if I say now volume of distribution of A will be, let us see the formula, X by C. That means X over here is the amount of drug added, so 10 divided by 2 by 100. And volume of distribution for B will be 10 divided by 7 by 100. So volume of distribution for A will be your 1000 by 2, and volume of distribution for B will be 1000 by 7. This is 500, and this is approximately 143, right? If you just take it approximately. Now we have to understand that which drug goes where. Now drug A majorly goes into the tissue and very small amount remains in the plasma, whereas drug B majorly remains in the plasma and very small amount goes into the tissue. So we can make a statement over here that the drug which majorly goes into the tissue has a high volume of distribution, and the drug which has low volume of distribution majorly remains in the blood. So over here we can say that the drug that remains in the tissue has high volume of distribution, and the drug which remains in the plasma has low volume of distribution. So by seeing the volume of distribution, we can comment whether the drug will remain in the blood or the drug will get localized in the tissue. So volume of distribution is a theoretical concept that gives us an idea about the distribution of the drug in the body, like in what space the drug is going to get distributed. Right. So I believe by now you have understood this concept of volume of distribution. So the concept is, first of all, you have to remember that it is a theoretical volume which gives idea about the drug distribution across the fluid spaces of the body. Right. I believe by using this example and simple mathematics, you have understood the idea of volume of distribution. If you have enjoyed this video, please hit the like button, share this video among your friends and peers of medical school, and by any chance, if you haven't subscribed to the channel, please hit the subscribe button, press the bell icon and select all so that you never ever miss a video from my channel. Until then, bye bye. See you in the next one.